Welcome for the second part of the full mouth rehabilitation, the systematic approach to the full mouth rehabilitation. And in this second part, we will try to take care about the details of planning and realization of cases of where we have some implant, some natural teeth, and we will end up with a case where we have to make a full mouth rehabilitation on implant. Before to start with the surgery, right now what we want to have is a temporary restoration that must fit exactly our request and our aesthetic analysis, what we test in the mouth before, so a copy of our radiographic stent. And for sure, what we want to obtain in this case is to obtain really good primary stability in the posterior implant, just to have the space to create this vertical augmentation, so placing a PTFE membrane in the front. And so we create this provisional restoration through the use of a framework inside to make it stronger, and we create special effect in the incisal area in the way to make it much more natural. So this is our target, and we try to stay a little far away from the tissue to avoid any kind of pressure. So before to start, right now, what we have, it's the surgical guide, a surgical template, and our provisional restoration that in some way they have the same shape, the same dimension, and are following the same target. So our surgery have to start in this case with like a normal guide. It's not going to fix this because it will give us only the indication of the implant positioning, and so with only the 2 mm drill, not more. And with this, we will able to design perfectly our incision, okay? And so to open the flap in the best way, as you can see here. And then for sure you have to go full thickness in all area in the way to analyze really well the situation. Look at here, there are the position of the central incisor, and then we start with our surgical guide in the way to locate exactly the implant, and considering also the position of the future restoration, the dimension of the future restoration. As you saw before, there was the need to go for, in this case, we used the summer technique to increase a little bit the bone in the sinus area, as you can see here. And what is interesting right now, that in a case like this, in some area, for example in the central incisor, we place the implant sticking out from the bone because in that area the target was to make a GBR. And plus, in other area, for example in the canine, where there was no pink tissue in the radiographic stent, or better, in the analysis, we found that there was more bone than what we need. We keep the implant deeper and we use the bone that was there over the implant in the way to obtain the graft in that area. Okay, so look at here, we are placing all our implant, and then right now, considering how we can obtain the bony peak between the two central incisors, we are, as you can see here, place the implant 2 mm above the crest, but right now we want to have something more. We told that we need 4 mm above the bone to obtain a predictable papilla there. So the target here was obtained with the use of two healing abutment of 3 mm in high that we place over the implant just to support our PTFE titanium reinforced membrane, and in the way to have this right space in that position. So right now we are finishing in the posterior, as you can see, and then for sure the primary stability, as I told you, it's really important. Is this the reason because we used this kind of implant, aggressive implant, was noble active, and as you can see right now we are collecting bone. This is our mix between autogenous and xenograft. This is the position. You can see the healing abutment, 3 mm healing abutment, and we start to pack inside this material in the gap between the membrane and the bone. And after a carefully positioning of the bone and this mix, we fix the membrane with some tacks, because it's important to have a really good fixation of the tacks, and then really an important point is to release, to avoid any tension in the soft tissue. And plus we decided to add some more in the concavity that was in the buccal bone. And look at here, we are going to test the passivity of the flap, considering that normally we try to overlap at least 2 millimeters the palatal flap with the buccal one. And right now what we can see is after 3 months post-op, everything is going to heal in a really smooth way. And what we can appreciate in this picture, that right now we have a mucogingival junction displacement. So we have no more keratinized tissue in the front, and we will see later. But look, the aesthetic is exactly what we considered in the beginning. For me, the aesthetic of this provisional restoration was quite good. And right now, what was our treatment planning? So what we decided in the beginning was exactly what we were able to obtain in this case. And this is a case that we did with Sasha Jovanovic during a live demonstration in Venice some years ago. And I think that this is a good example in how to place our implant, considering to start from a precise starting point. Okay. And after 9 months, this was the result. It was a great result. So we were able to obtain a lot of bone up to the healing abutment. So we were almost 5 millimeters away from the previous level of the bone, so 1 millimeter more, but we have to consider some contraction as well. And then we deal with some connective tissue graft as well, in the way to have the space to play with the tissue, or the thickness to play with the tissue. And we did the same for the lower, so we position the implant with the same concept, so placing the implant in the right position, creating some bleeding to obtain a better integration or a better blood supply for our graft. And then after all the surgery, we use the radiographic stent, or like in this case the surgical guide, to maintain the vertical dimension that we planned in the beginning, and just in the way to give the opportunity to the lab to copy for the second provisional restoration. Right now, the second provisional restoration will give us the opportunity to shape the tissue, in the best way, so with a fixed restoration, because if we pass directly to the final restoration with a removable one, we are not able to finalize it, to fine-tuning the tissue around our implant. Look at here, this was the second provisional restoration that we found exactly the same concept of a final restoration, so trying to maintain the occlusion, the shape, the dimension that we saw before. And sometimes we use this kind of template just to guide in a little way our soft tissue management during the provisional restoration placement. And this was the temporary immediately after the placement. You see that I touched in some places the tissue because there was too much pressure there, but the final result was immediately afterwards this. And you see that right now the aesthetic is exactly the same, so we go exactly step by step in the right direction without any change. And so it's interesting, the digital stream, so starting from our analysis to the planification with the digital stream. This is really important. Look at here how we were able to obtain this predictable result considering the step by step. So every single time we place implant, what I would like to suggest is to avoid to start to plan implant starting from the prosthesis that in some way is not the nicest prosthesis, so the old one, because in the future you are going to consider, or inside the software we are going to consider this as the target. So if it's not matching your aesthetic analysis, you have to go for a new prosthesis, okay? And this was 1 year after, after the provisional restoration in the mouth, so in the way to have the maturation of the soft tissue, as you can see here. And this was the way to transfer the bite registration. So we didn't take another bite registration, we used the provisional restoration in the way to maintain and to copy exactly the situation. Look at here right now. And so right now, for the final restoration, our worry was about what kind of material can we use. Remember that every single time you go for a full mouth rehabilitation on implant, we are worried about chipping, for example. So our idea was to create a zirconia framework and to cement over it a monolithic lithium disilicate crown. And so we created this kind of framework, really not supporting framework, so only this line of zirconia where we are going to create over it the shape of the final, okay, crown. Like you can see here in the workshop, we create a precise hole for the final one, for our crown, and so really precise, and then we cement it together with resin cement to obtain this nice and predictable restoration. Why? Because it's really hard, the adhesion between the zirconia and the lithium disilicate through the use of resin cement, and because we are considering a monolithic crown here. So this was the final restoration, as you can see here on the cast, and this is the final restoration in the mouth. With this, I want to conclude. I want to thank you for your attention. I hope to give you some new thought, and I hope to see you soon around the world or in our next guide lecture. Thank you.
For more education programs, visit the GIDE Institute at www.guidedental.com.